What is asbestosis? Asbestosis is a chronic lung disease caused by prolonged inhalation of asbestos fibers. These fibers can lead to scarring of lung tissue, pulmonary fibrosis, resulting in breathing difficulties and reduced lung function. Asbestosis typically develops years after exposure to asbestos, often affecting people who worked in industries like construction, shipbuilding, and insulation manufacturing. Causes of asbestosis. Asbestosis occurs due to the inhalation of asbestos fibers, which are tiny, durable, and resistant to heat. Once inhaled, these fibers become trapped in the lungs, where they irritate and damage lung tissue over time. The body cannot effectively break down or remove asbestos fibers, leading to scarring, fibrosis. High-risk occupations and exposure. 1. Construction workers, especially those handling insulation or roofing materials. 2. Shipyard workers. 3. Factory workers dealing with asbestos-containing products. 4. Miners and millers of asbestos. 5. Mechanics, brake linings and clutches in vehicles. 6. Demolition workers exposed to asbestos in older buildings. Symptoms of asbestosis. Symptoms typically develop gradually and may not appear until 10 to 40 years after initial exposure. Common symptoms include 1. Shortness of breath. Worsens with physical activity and progresses over time. 2. Persistent dry cough. Often non-productive, no mucus. 3. Chest tightness or pain. 4. Clubbing of fingers. Fingertips become enlarged and rounded due to chronic low oxygen levels. 5. Fatigue. Generalized tiredness and weakness. 6. Loss of appetite and weight loss. Occurs in advanced cases. Complications of asbestosis. 1. Chronic respiratory failure. Severe scarring can impair oxygen exchange in the lungs. 2. Pulmonary hypertension. High blood pressure in the lungs due to restricted blood flow. 3. Increased risk of lung cancer. Asbestosis significantly raises the risk, especially in smokers. 4. Mesothelioma. A rare cancer affecting the lining of the lungs or abdomen, strongly linked to asbestos exposure. Diagnosis of asbestosis. 1. Medical history. Detailed occupational and environmental exposure history. 2. Physical examination. Listening to lung sounds for crackles, heard with a stethoscope. 3. Imaging tests. Chest X-ray shows scarring or irregularities in lung tissue. CT scan provides more detailed images of lung fibrosis. 4. Pulmonary function tests, PFTs, measures lung capacity and airflow. 5. Blood oxygen levels, assessed with pulse oximetry or arterial blood gas tests. 6. Biopsy or bronchoscopy, rarely used but may confirm the presence of asbestos fibers in lung tissue. Treatment for asbestosis. There is no cure for asbestosis, as the lung damage is irreversible. Treatment focuses on managing symptoms, slowing disease progression, and improving quality of life. 1. Medications. Bronchodilators, to open airways and improve breathing. Corticosteroids, to reduce inflammation in some cases. Oxygen therapy for patients with low blood oxygen levels. 2. Pulmonary rehabilitation. A program of exercise, breathing techniques, and education to enhance lung function and stamina. 3. Vaccinations. Flu and pneumonia vaccines reduce the risk of respiratory infections. 4. Lifestyle changes. Quit smoking to minimize further lung damage and cancer risk. Avoid further asbestos exposure. 5. Surgery. Rarely required, a lung transplant may be considered in severe cases. Prevention of asbestosis. 1. Avoid asbestos exposure. Follow workplace safety regulations, including wearing protective equipment and ensuring proper ventilation. 2. Abide by regulations. Follow guidelines for the safe removal and handling of asbestos-containing materials. 3. Regular health check UPS. For individuals with known exposure, periodic lung screenings can help detect issues early. Prognosis of asbestosis. The progression of asbestosis varies among individuals. While it can be managed effectively in mild cases, severe scarring can lead to significant breathing difficulties and complications. Early detection and management are critical to maintaining quality of life and preventing further complications. If you suspect exposure to asbestos or experience symptoms like chronic shortness of breath, consult a healthcare provider for evaluation.